Okay, our next speakers will be Elaine Hill from the University of Rochester Medical Center and Meredith Adams of Wake Forest University School of Medicine, presenting about COVID-19 pandemic mitigation, community economic and social vulnerability, and opioid use disorder. Meredith and Elaine, the floor is yours.
Thank you very much. And thank you for working through our whole title so I didn't have to. That's awesome. So I'm Meredith, not Elaine. We are MPIs on this project. This is what happens when two science friends get together and bring sort of different perspectives. I'm not a health economist. I'm an anesthesiologist, but we've been sort of thinking about this problem in a lot of different ways for a while. Thank you to everyone that is hanging in there for the end of this very, robust day of awesome information. It's been really cool to sort of be welcomed into the family, but also really to see like what people are doing. Because I think a lot of what we've been trying to do is quilt together all these different pieces. And I feel like a lot of what we're doing is amplified by these individual projects, which really pulls us together. Next slide. Okay, so this is our awesome team. Again, I mentioned Elaine already and myself, but we've got Team Indiana, where we've got Sumena and Kosali, who are doing awesome work with Optum for our project. Tansy is at the University of Rochester, helping us out on the stat side. At Wake Forest, we've got Umit and Rob helping us with the NC3 and 3C. Which is kind of working through all these different data sources. We're also going to be working with CMS data. And then we have Tamara, who is our gift from NIDA, who's also bringing in lots of cool ideas and perspectives and sort of wrapping up the team so that we can really sort of have the most impact for the ideas that we're working through. Next slide, please. Thank you. So we have been working in the opioid use space for a while prior to COVID. And, a lot of the trends that have been sort of shifting and changing have to do with prescribing and policy. And, one of the things that's really clear is that the shifts that happened socially and communities really impacted substance use disorder and mental health, sort of as echoed by some of the other projects mentioned earlier. But, a lot of the shifts we think have made things worse. We are a very shiny project, having gotten funded this summer, so we don't have a lot to show in terms of output, but I want to kind of walk you through the story of what we're thinking about with our project. Next slide, please. So the overall objective was to look at how the pandemic exacerbated these economic and social vulnerabilities, really thinking that there were some groups that were more vulnerable at baseline, and then sort of this gap that everyone's been mentioning all day has been made much, much worse. And we're hoping by the time we get to next year, we really will be able to sort of bring that forward and give you a little bit more information specifically with that, but we'll walk you through the process of how we think we're going to get there with that. And then the hypothesis, as we mentioned, the story that we're focusing on is that we think the prevalence of IUD and related harms have really escalated based on those vulnerabilities, and sort of teasing out some of those areas can be helpful with policy. Go ahead, next slide. Perfect. Okay, so again, the questions that really sort of interest us is not just one of these levels, which I think a lot of times the projects are focused on sort of one space with this sort of ecological model, but the nice thing is where we are with the data world is that we can really map these things together. We can start connecting these dots and really bringing in, areas of social polarization and, the different neighborhood aspects or healthcare systems, as well as all these disruptions, and really sort of see how all this came together to really impact those numbers, because there's so much going on here that, hopefully we'll be able to tease out and get a lot more detail. But really the questions that we're wondering about are sort of tied to sort of all these levels and aren't really something we think we can answer with just a single place. Next slide, please. Okay, and so Elaine,
I will take over.
Yes.
Thank you, Meredith. So I'll go over our aims. In the blue is sort of the high level, and in the underneath is the more specific language. So our first aim is to look at short-term OUD outcomes for communities with these multi-level economic vulnerabilities. I apologize for my dog. Somebody rang my doorbell, so if you hear whining, that's happening, of course. And so we're really interested in that early period, and much like many of the projects, we will be looking at both the mitigation efforts that occurred early on, the shutdowns, and try to understand how that's impacting different places differentially, and sort of interacts with pre-pandemic OUD burden. So that's sort of the main thing that we're interested in quantifying, is where are the places that had pre-pandemic OUD burden, and were they differentially impacted by the pandemic? What are their trajectories in that first year or so of the pandemic? Then in our second aim, we will be examining longer term outcomes. We're very blessed to have the U01 and 5 years of funding. And so by even the mid-year of our project, we will be, a few years out from, the beginning of this. So we're really excited to look at longer term outcomes for these communities. And then we'll be able to think about the vaccination campaigns and some of the economic conditions as they've developed. We're in the middle of this right now. Will there be a recession? What's coming? We certainly didn't anticipate Ukraine and gas prices and inflation. And so we'll be incorporating all of those components that are happening in real time, as they're occurring, after 2020, basically. So we are using a number of data sources, and Meredith mentioned them, sort of orienting them to our team members. So we'll be using data sources that many of you are using or are familiar with, including the NCHS MCOD data. We'll be working with 100% Medicare and Medicaid claims. We work with Optum, and then we are bringing in this additional data source that I haven't heard anyone mention, which is the National COVID Cohort Collaborative, the N3C. This is a multi-site harmonized electronic medical record database that we're really excited to leverage here, that Meredith and I have been working on for a number of years. So we have a few proposed initial outcomes of interest, and we look forward to possibly thinking about common data elements for those of us who are thinking about mental health and substance use and OUD. There's a few projects it might make sense for us to get on the same page about some ideal or optimal outcomes to look at, but we have some for initiation, continuation, and escalation. We certainly are interested in not just those who had OUD prior to the pandemic, but who may be at risk of developing OUD, possibly due to the pandemic. So, and maybe even to COVID infection. So some of our work not related to this U01 has been thinking about long COVID that was brought up earlier, and thinking about pain post-COVID. So this could lead to another sort of process by which individuals could be at risk for OUD. So we have a number of, covariates, and Meredith had that diagram of how we're thinking about it conceptually. And so we've been trying to, map those concepts onto actual variables that we will be employing in our empirical models. They're across multi-level. I just want to highlight some of the data sources, since that's something that members on this call are interested in. Some of these you have all mentioned. I'm really excited to look at NANDA. We propose to use the AHRQ SCUH database, which is at the zip code level, and I think very comparable and similar. So it'll be exciting to, sort of combine efforts to think about these neighborhood factors. And then a number of data sources that might be more specific to health systems, as well as opioid risk environments. So in addition to these covariates, we're also thinking about policy, and how that might be playing a role in all these multifaceted things going on. And so we'll be looking at the mitigation policies. We'll be thinking about economic precarity and various federal stimulus, policies that occurred within the health system, including coverage expansions and changes in reimbursement for telemedicine. And then there's some that are very specific to substance use that we're excited to bring to the table. So just to summarize, we have a number of expected outcomes and contributions, including thinking about short, mid, and if you want to think 5 or 6 years out as long-term estimates of the impact on OUD outcomes. We'll be thinking about this for healthcare delivery, economic conditions and social disruptions, as well as these mitigation strategies. And to finish up, we're hoping that our research will have some use for informing broader local, state, and national policies for either this pandemic as it unfolds or future ones. So thank you very much. Excited to work with you all.